Okay, welcome back to individual module 4, um, our lecture on sexuality. And this is part 2, and we're going to finish up with sexually transmitted infections. Here are your learning outcomes, and we're going to start off with HIV and AIDS. So what is HIV and AIDS? This is a retrovirus that causes destruction of the T lymphocytes in the body, and it causes great immunosuppression. Risk factors for people are IV drug users, multiple sex partners, bisexuality, people with a history of STDs, and blood transfusions prior to, I believe, 1980 something. We now um, test all blood for the presence of different types of diseases, specifically HIV and is one of them. But prior to our knowledge about HIV, we did not test blood for that. So there are some individuals who contracted HIV through blood transfusions prior to that time. Signs and symptoms of HIV are fatigue, diarrhea, weight loss, anemia, a positive Western blot test, high viral loads, and CD4 cell counts. And we manage people who have HIV through counseling and education to help prevent it. We use standard precautions for those who do have it. For pregnant women, we avoid any type of invasive procedure because we do not want to transmit the virus from the mother to the fetus. Um, Also, for pregnant women, we want them to continue their antiviral therapy. Normally, they're on something called Retrovir, and we want them to continue to take that and be followed closely, because if they stop taking it, it increases the chance that the fetus will contract that virus. Um, Retrovir is also given to the newborn of a positive mother through about 6 weeks of age. And if you remember back to a previous lecture, I talked about the injections that a newborn gets right after delivery. One of them was hepatitis B, and the other one was vitamin K. Normally, those are given before a bath is ever given. However, for individuals who have HIV, we want to bathe those newborn babies first and then give the injections. We do not want to risk injecting any type of HIV virus that may be on their skin into their body. Um, the HIV virus is also present in breast milk, so these mothers who are positive cannot breastfeed their babies. Chlamydia. This is a big sexually transmitted infection that we see quite often. It's a bacterial infection. This is the most common one, and it's usually linked in newborns to conjunctivitis, which will show up somewhere between 5 to 12 days after that baby is born. Risk factors for chlamydia are people who have multiple sex partners or unsafe sex practices. Usually it's asymptomatic, so the mother or the female or the male don't even know that they have it. Sometimes they'll have vaginal spotting or they'll have some itching, and they may have a white or a watery discharge. We like to definitely educate in regards to all sexually transmitted infections, but if someone comes in and has chlamydia and being treated for it, they're given a broad spectrum antibiotic. Usually it's Zithromax. And we want to educate them to take that entire prescription, and we need to work with those individuals to identify and to treat all of the partners that they've come in contact with. And in 3 weeks' time, we want to bring these individuals back into the office and retest them to be sure that the antibiotic worked and that it eradicated um, the infection. All newborns get erythromycin um, in their eyes post delivery. And one reason why is because of chlamydia and gonorrhea. Because oftentimes they're asymptomatic, individuals don't even know that they are infected with these sexually transmitted diseases. And so we just give all newborns an erythromycin post delivery in their eyes. Um, let's move on to gonorrhea. This is also a bacterial infection. It can be transmitted genital to genital contact, genital to anal contact, or genital to oral contact. It is linked to stillbirth. It is linked to preterm labor in pregnant women. It is linked to small for gestational age newborns. And it's also linked to conjunctivitis, just like chlamydia. The risk factors are people with multiple sex partners and unsafe sex practices. And men often have a discharge from the urethra. They often have pain on urination and they have frequency with urination as well. Females might experience a lower abdominal pain. They might experience pain with their periods or dysmenorrhea. They have a yellowish green discharge, and upon exam, you may find that the vulva and the vaginal walls are very reddened. If gonorrhea is left untreated, it can cause pelvic inflammatory disease, which can ultimately cause infertility. Um, we manage gonorrhea in quite the same way we do chlamydia. We treat it with a broad spectrum antibiotic, and we do that with either Zithromax, a 7-day supply, or Rocephin intramuscularly. These days, we really like to use that Rocephin because there's no chance that the patient will not complete that 7-day course of antibiotic, and we can eradicate that infection a little quicker. But still, we need to educate our patients on how it's transmitted because oftentimes people don't understand that with gonorrhea that it can be transmitted in different ways, not just through intercourse, but through oral sex and anal sex, and it's important that they know that. Um, Also, we want to identify and treat all the partners of the person who we've diagnosed. Trichomonas is a parasitic sexually transmitted infection. This can be linked to premature rupture of membranes for pregnant women, which just means that their water breaks early, preterm labor, and it's also linked to low birth weight newborns, which puts the baby at a great risk for lots of other issues in life. Risk factors are the same: multiple sex partners and unsafe sex practices. This can be asymptomatic, but oftentimes you find that trick comes along with itching and a foul odor that has a very fishy smell. It has a very distinct, pungent smell. Sometimes there's a greenish discharge, and sometimes these people will have bleeding after intercourse. Um, like with all the other ones, we treat it with a broad spectrum antibiotic. Usually it's a Zithromax for 7 days or the Rocephin IM, and if we have the choice, we want to do the Rocephin. We want to educate these people on how it's transmitted. We want to teach them to take their entire prescription, and we want their help in identifying and treating all their other partners. And sometimes that is the hardest part whenever we're dealing with individuals who have a sexually transmitted infection. It's embarrassing. Um, Well, it used to be embarrassing. I don't know. I've taken care of some people these days who don't find it embarrassing, but many times the people are embarrassed and they don't want to call their partners or the people that they have slept with and tell them that they've got this. But it's very important that we try to push them to do that so that their partners can come in and get treated. With trichomonas, you can actually see this. We could oftentimes will culture a discharge, like a vaginal discharge, and put it on a slide. And with trichomonas, you can actually see that parasite swim around under the microscope. There's a little flagella and everything, and you can just see it wiggling all over the place, um, which helps you understand why they have itching. The next one we're going to talk about is Candida or yeast, and this is a fungal infection. Um, there are many risk factors related to yeast infections or Candida. It does not have to be a sexually transmitted infection. You can get it other ways or just because of normal body processes, but it's listed with sexually transmitted infections because um, it can be transmitted that way. But the biggest risk factors are people who have diabetes, people who are taking oral contraceptives, and people who have had recent anti-treatment. One thing with yeast is that our body has a normal flora that it attempts to maintain to keep away things like yeast. If we kill off that normal flora with antibiotics or with oral contraceptives or if our blood is a little too sweet with diabetes, then we create an environment where yeast can grow and thrive. And if it runs rampant, then we end up with candida or a yeast infection. And it can occur in different places. Um, if it's a vaginal yeast infection, you often find that you have vulvar itching and redness. You will see a thick, creamy, white discharge. You can find white patches on the vaginal walls or gray to white patches on the tongue or the gums of a newborn. So a yeast infection can occur vaginally, it can occur orally, it can occur on the breast of a breastfeeding mom. So it's important to know that it can occur in lots of different areas. We treat it with an antifungal agent, usually diflucan or fluconazole, sorry. And we want to teach our patients to avoid tight-fitting clothing, to avoid damp clothing. Yogurt often will help because it provides our body with active cultures to fight off yeast. Douching is a no-no. And we want to teach our patients to avoid before and after intercourse to hopefully prevent any types of yeast infections. Bacterial vaginosis, or BV, you will often hear people call it. And this is just a bacterial infection that's caused by an overcolonization of normal vaginal bacterial flora. There is always a normal flora that is maintained in the vagina. And if there's an overcolonization of that normal flora, then we can end up with a bacterial infection. It's most common in women between ages 15 to 44, which is a pretty good age range, and it's not really considered a sexually transmitted infection, but it can be linked to prematurity and low birth weight newborns in pregnant women. The cause really is unknown because it's just linked to an imbalance of good and bad bacteria, and oftentimes you can't pinpoint what causes that imbalance. But the risk increases for spread and transfer of sexually transmitted infections if you have this. So it's important to avoid multiple partners. And those people who are regular douchers also are at risk to get BV. Um, Sometimes it can be asymptomatic, but you can also see a thin white gray discharge. There's also a very fishy odor with BV, and it causes itchiness and pain and oftentimes burning whenever you urinate. We treat this with Flagyl, and we have to educate our patients to take the entire prescription. And educate them regarding the risks for sexually transmitted infection transmission, because the risk of spreading sexually transmitted infections is greater when you have this. We need to teach them not to douche and to limit their sex partners. Human papillomavirus, or HPV. This is a viral infection, and it's the most common sexually transmitted infection in the United States. This causes genital warts and can also turn into cervical cancer. It's linked to premature birth and miscarriages. And the risk factors are the same as with other sexually transmitted infections, people who have multiple partners or who have unprotected sex. A lot of the times it's asymptomatic until you have an outbreak. Genital warts are caused by a subgroup of HPV. So you might see warts, but not with everyone, because the genital warts are caused by like a different subset of the HPV virus. So if you don't have that particular subgroup, then you might not see the warts. You can also see precancerous changes in the cervix, and that's also caused by a certain subgroup of the HPV infection. There is no treatment for HPV. The body will often clear it up on its own, but recently, or I say recently, several years ago, they came up with an immunization for HPV called the Gardasil, and it can be given to both boys and girls. They recommend that it's given when they're about 12 years old, but we have to educate our clients regarding the risks for sexually transmitted infection and the transmission of that. So it's very important whenever you're talking to adolescents and working with them to let them know that just because they don't see a discharge or they don't see any warts does not mean that the partner they're getting ready to lie down with does not have a sexually transmitted infection, because as you can see on many of these under signs and symptoms, oftentimes these sexually transmitted infections are asymptomatic. Genital herpes. This is a viral infection that's caused by herpes simplex types 1 and 2. It is transmitted vaginally, anally, and orally. It's linked to premature birth, miscarriages, and it can be linked to neonatal herpes infection. Signs and symptoms for genital herpes can be asymptomatic for very long periods of time until you have an outbreak, which looks like blisters or sores to the genitalia. Oftentimes there is a little bit of a flu-like symptom with the first outbreak. So even with the first outbreak, many individuals don't even realize something's wrong. They may think that they just have a cold and don't even recognize the first minor outbreak. So it might go untreated for a long period of time because either it was asymptomatic or the first outbreak was consisted of the flu-like symptoms and a very small outbreak. Um, There is no medical treatment to cure genital herpes, but we do put these people on antiviral drugs to suppress their outbreaks. These people are on a cyclovir usually. We want to educate them on the risk to transmit it to other people and how they can care for themselves. Um, if we have a pregnant mother who is positive for herpes, then we have to do a very thorough exam prior to delivery to rule out an outbreak. Because if she has an active outbreak, then we need to schedule a cesarean section. We do not want to have a vaginal delivery if a mother has an active outbreak of genital herpes. And oftentimes, um, they'll just do a C-section anyway. Syphilis. Um, Syphilis is a bacterial infection, and it comes in all kinds of different levels. There's a primary, a secondary, a tertiary, and a congenital type of syphilis. It is transmitted vaginally, anally, and through oral sex, and it's linked to miscarriages, stillbirth, and prematurity, low birth weight, newborns. It's linked to neonatal and fetal death and congenital disease in newborns. Um, and as primitive as this may sound, it is still a cause of perinatal mortality and morbidity. Um, and that's because people who contract syphilis are often asymptomatic initially. There again, there have been very few of these sexually transmitted infections that we have discussed, um, which do not have the possibility of being asymptomatic. Most of them have the ability to be asymptomatic, which hides itself from your patient, and they may not know. So with syphilis, it's often asymptomatic initially, which puts pregnant women especially at a great risk if they have multiple sex partners or um, have unprotected sex, and it puts them at risk for a perinatal loss because they may not even know they have it. What we often see first is a canker or a sore. It's oftentimes on the genitals, the anus, orally, or on the skin somewhere, and it heals itself within 3 to 6 weeks. And it can look like an ingrown hair, so a lot of the times people don't even think anything about it, and they just let it go because it heals up. So you also might see enlarged lymph nodes near that sore. You might find people who have a non-pruritic rash, so it does not itch, and they do have it on the palms and the soles of their feet. Mucus patches or sores around the mouth and the genitals. Condylomata latas. Those are moist, warty patches in the skin folds or in the vagina, and those are also a symptom of syphilis. These people can have cardiovascular issues in the more advanced stages of syphilis. They can have CNS disturbances or neurosyphilis towards the end. They can have tumors. And if a newborn contracts syphilis or has a congenital syphilis, they can be born with cataracts, they can be born deaf or have seizures or just be born dead. Early treatment is the key to curing syphilis, but it will not reverse any damage that's already been done. We treat it with doxycycline, tetracycline, and penicillin G. We identify and we treat all partners, and this is very important with this sexually transmitted disease. We need to educate moms, especially, or females, in regards to congenital syphilis and what it can do to newborn babies. Everyone who gets pregnant has an RPR during pregnancy and again at delivery, and that's a lab test that tells us whether or not whether or not that person has syphilis. So they get it twice during their pregnancy, once at the beginning and then once before delivery. We treat a mom as soon as possible if this RPR comes back positive. And if the mom is positive, we treat her newborn immediately after delivery so that we can hopefully prevent any type of congenital syphilis. So in relation to sexually transmitted infections, let's talk about the nursing assessment. Well, we have to do a focused interview because this will guide your physical assessment. We want to know what issues your person is having. We want to know what their risk factors are. Are they a virgin? Are they when I say a virgin, I mean I'm thinking about adolescents who may be abused. If they are sexually active adolescents who have multiple partners, we want to know that. We want to know what their signs and symptoms are because that will help you focus on the area that you need to focus on whenever you're doing your assessment. We want follow-up questions. After we do our education with these people, we want them to ask us questions. We want to do follow-up questions with them, and one specifically is identifying partners and getting them in for treatment. We have to be sensitive to the client's need for privacy. We want to use terminology they're comfortable with, and we want to let the client guide the conversation as much as possible. They will open up to you more if you can develop a good rapport with them and they feel comfortable talking to you and they don't feel judged. We want to examine the perineal area. We look for abnormal discharge. We ask about pelvic pain. We look for inflammation. And we smell for bad odors. And lab testing oftentimes is necessary as well, especially for pregnant women. All pregnant women, like I said earlier, with syphilis get that RPR. But along with the RPR screening for syphilis, they also receive a chlamydia and a gonorrhea test as well. That's done at the beginning of a pregnancy and before delivery. Here's some nursing diagnoses to consider whenever you're thinking about sexually transmitted infections: acute pain, knowledge deficit, sexual dysfunction, and situational low self-esteem. Education is key when it comes to sexually transmitted diseases. We want to educate clients on the risk factors and ways they can prevent STDs or STIs. We want to administer prescribed medications. If there is an option to administer Rosefin IM, we want to do that instead of a 7-day supply of Zithromax. If they need analgesics, we want to educate them on what they can take. Usually it's just something over the counter like Tylenol or Motrin. We want to provide a supportive and a non-judgmental environment. Offer support group information specifically for those people who are affected by HIV because that can be devastating. And we want to educate on disease management for non-curable sexually transmitted infections such as HPV, HIV, genital herpes, etc. And outcome-wise, what do we expect? We want our client ideally to be free of sexually transmitted infections if possible. And if it's not possible, if they have one that's not curable, then we want to be able to manage symptoms and keep them at their healthiest state. And we also want them to be sexually responsible. We want their signs and symptoms to be minimized, and we want to provide a good quality of life for those individuals. We want them to be able to teach back prevention methods, and we want them to decrease or stop all of their risky behaviors, and we want them to remain abstinent until that sexually transmitted infection is cured. And that is it for part 2 of individual module 4, our lecture on the concept of sexuality in regards to sexually transmitted diseases. Thanks for tuning in.